Hi, welcome back everyone. Today we will be talking about the processes of doshas and dhatus being aggravated and how that develops into a disease or pathology. So when we talked earlier about different factors that affect the doshas and that either cause it to increase or decrease, those are also known as nidanas or causative factors, and we'll talk more about that in the live sessions. But in order to understand the dynamic of how these doshas increase or decrease, we need to look further in their relation to each other and how that change in its normal state that develops into a pathology. So we talked about these different causative factors or these different gunas. When we talk about the change in doshas, there are three factors that we look at. A dosha can either increase or decrease in its quality or guna, in its karma or its action, and also in its quantity or matra. So these are the three things that actually change in the dosha when there is a disturbance from its normal state. So for instance, if we are exposed to factors that cause a decrease of dosha, it will decrease in either one of these three things, in its quality, its action, or its quantity. And if it's also, we're talking about an increase of dosha or vriddhi state of the doshas, then we're also looking at either the quality, the gunas, the karma, or the matra or the quantity. Okay, so when these doshas start to increase or decrease, they start to produce certain signs and symptoms. In Sushruta Samhita, he has described the actual progression of a disturbed dosha and how it starts to change and starts to provide these signs and symptoms in the body. So in that, he has described 6 stages in where we're looking at a change in dosha. These 6 stages are known as the SadKriya kala, or the 6 kriya kala. 6 kriya means action and kala means time. So the 6 stages of action of the doshas in this particular order. In that, he talks about we look at, again, the doshas in relation to its place and how it starts to then affect the other doshas as well. So for instance, we looked at earlier the doshas in their respective homes or their domains. So for instance, kapha is from the chest upwards, pitta is from sort of the sternum to the umbilicus, and then vata is from below the umbilicus. These are the major domains or the places where the doshas reside. So when we talk about these different stages, we're looking at disturbance of the doshas in its normal place, in its domain. When it starts to increase, it starts to affect its own domain. Depending on how chronic or how severe the causative factors are that are affecting the doshas, then it starts to increase exponentially and may even have a chance to spread out of its domain and go and start to affect the other doshas in their domain. So that's sort of a very quick description of what we're looking at in these SadKriya kalas. Why are the SadKriya kalas important for us to know? Because this gives us an idea as to where the doshas are at that particular time and what would be the appropriate treatment measures or corrective measures. So, in getting into that, the 6 kriya kalas are sanchaya, prakopa, prasara, sthana samshraya, vyakti, and bheda. Sanchaya means when there is a mild increase of doshas. So for instance, we know that the doshas tend to be predominant at different times of the day, in different seasons, and different times of the night, and different times of our age as well. So when there is a slight increase of the doshas according to the daytime, so for instance, kapha being more predominant in the morning, that is sort of like a sanchaya, where there's a mild increase of kapha. But just by the passing of time and us entering into pitta kala, or the time of pitta, the kapha naturally tends to go down and it corrects itself, and then the pitta takes over. So this is a mild increase of kapha or a predominance of kapha, but it naturally gets subsided. We were talking about the increase and decrease of doshas, it's also important for us to understand that in most cases where there is a pathology, it's most likely an increase of the doshas as opposed to a decreased state of the doshas. In a decreased state of the doshas, it's more of, it produces signs and symptoms of a malnourishment or a malnourished dosha. So it's just a deficiency, and it doesn't have enough strength to really produce a pathology. If it is in a decreased state, the corrective measures for that would just be to give other factors, either a diet or lifestyle factors, or even herbs, which would help to increase the qualities of that dosha and bring it back to its normal state. In most cases where we get actual pathologies or disease conditions, it's more representative of a increased dosha or a dosha vriddhi. So in that case, where we talk about these 6 stages of pathology, or basically looking at chronicity as well, we know that there is an increase of doshas here. Okay? So the 6 stages of increased doshas and pathology, as described by Sushruta Samhita, is first sanshaya, second is prakopa, next is prasara, fourth is sthana samshraya, fifth is vyakti, and the 6th is bheda. So in the first stage of samshaya, we're looking at a mild increase of the doshas. So for instance, we know that in different times of the day, the night, in different stages of digestion as well as stages in our life, there is a predominance of the doshas. They tend to be mildly increased. And as that time passes, it gradually decreases or it pacifies itself. So at that point, if we were to consume or expose ourselves to other factors or other qualities that are similar to that dosha, it also helps in giving it a little bit of an extra boost and a little bit of an increase of that dosha. So for instance, if in the kapha kala, or the time of kapha predominance, such as the early morning, if we were to consume foods that are equally have a kapha increasing quality, such as if we were to eat bananas in the morning, which seems to be fairly healthy, but it has the ability to produce more kapha. So eating bananas in the morning would actually add into the qualities of kapha and help to increase it a little bit more, as opposed to doing things that would help to remove that mild increase of kapha and not allow it to get to the point where it's gaining enough strength to produce an actual sign or symptom. Okay? So there is, in the state of samshaya, there is a cumulative increase or a mild increase of the doshas in its own place or in its own domain. At that point, there is also an aversion to these same qualities that would cause an increase of the doshas. So an example of that is, for instance, if you eat a heavy meal, right? You eat a heavy meal and it's suppressing your agni, it's filling up your stomach and it's making you feel really heavy. At that point, that also increases the kapha, because it's similar, that heaviness and that those similar qualities of kapha. At the beginning of digestion is also the kapha time of digestion. So if we were eating a heavy meal, at that point, within that time period, we no longer feel like eating anything heavy, because that is the causative factor for the increase of kapha, and therefore we will have an aversion to those same causative factors because it's causing a discomfort. At the stage of samshaya, there is always some form of discomfort, some uneasiness. It's not full-blown, or it hasn't had enough strength to produce signs and symptoms for you to know exactly what's going on, but you get that uneasiness. So for instance, like if you have a cold coming on or you have a fever coming on, you get that state of uneasiness beforehand, before it actually becomes a full-blown, very visible, very well-known fever or cold. You get that uneasiness that you feel like you sort of have a scratching in the back of your throat, or you feel some sort of stuffiness, or you feel some uneasiness. You're not sure exactly what it is, but it's a change from the normal state of you feeling healthy. So that sort of discomfort that you feel is basically the stage of samshaya. The next stage is the state of prakopa. And here it's again a step advanced from the stage of samshaya. So again, we're exposing the body to qualities and activities that, or food and activities that are actually increasing or feeding into the dosha. So again, qualities, gunas that are similar to that dosha helps to add or increase the quantity or the strength of that dosha to produce more and more signs and symptoms. So for instance, in the example of you getting a cold, you're at the state where, say it's in the morning time, kapha is very mildly increased. You eat a banana that has, again, phlegm producing or heavy sort of slimy nature. It has all the qualities similar to kapha, so it mildly increases the kapha. Then you go ahead and have some cold water, and you go outside and it's raining and you don't cover your head. So again, you're exposing yourself to all of these qualities that are similar to kapha, that is cold, that is wet, that is moist, that produces more and more phlegm or sliminess. And all of these things, again, are feeding into the kapha. It's giving it more and more strength. You can consider it as adding a plus sign next to the kapha for each and every quality that you add into it, or that you expose yourself to. So the more strength that this kapha gets, the more it starts to increase, the more it has the ability now to show specific signs and symptoms. So now, instead of just the scratching in your throat, you now start to feel sort of a constriction in your throat because there's more quantity of kapha. And it also starts to increase in your sinuses, in your nose, that you start to feel this block. Okay, so that's again an increase of kapha there. So in the prakopa state, it is one step ahead of the sanshaya state. There is more qualities, more things that are added to the dosha. It's gaining strength, but it is still within its domain. So the kapha is increasing, but it's still in its area of above the chest. Okay? So that's the state of prakopa. You may have also come across these same terms, sanchaya or chaya, prakopa, and prashama, when we talked about the changes of doshas as per Vagpata or in Ashtanga Hridayam. But the difference between that is we're looking just at a mild increase and decrease, and also the normal state of the dosha as opposed to the pathological state of the doshas. What Shushruta here is describing is the process of a pathology and how it develops and how we start to see these different signs and symptoms. Okay? So even at the state of prakopa, you're not really going to get complete signs and symptoms just yet. These are just mild discomforts. And so it's giving you an idea as to which dosha is aggravated, but it's still not a pathology. We still can't really label it as a disease yet. It's just a discomfort. It's just a symptom. So at the state of prakopa, if we are able to correct the doshas at that point, if we are able to give opposite qualities at that point, we're able to pacify the dosha, we're able to bring it back to a normal state, and it doesn't get a chance to progress enough or gain enough strength to produce a pathology. Okay? That's why in order for us to understand which state these doshas are at is very important, because then we can know how much of an intensity of a change we need to produce in the body in order to correct the doshas. Okay? So the next state is prasara. So at this point, again, it's one step ahead of prakopa. The doshas are gaining more and more strength. They're really starting to gain momentum now. It started to actually not just increase in the quality, not just increase in its action, but also started to increase in quantity here. Here we're looking at all three of those factors of the dosha starting to increase. So in the state of prasara, the doshas have increased so much so that it's really occupying its full capacity of its domain. It's not just a slight increase or it's 1/3 of its domain. It's actually starting to fill up its whole domain. So when the doshas have increased in quantity that much, there's hyperfunctioning of those doshas, and you know what the normal functions of the doshas are, which we've discussed earlier. There's hyperfunctioning. There is, again, a very increased state of its qualities, and also now its quantity. It gets to the point where it's completely filling up its domain, and it's about to flow over. It's about to exit its domain and move over because it cannot be contained in its own place anymore. It's growing and growing and growing. So in that's this also the state where we look at where there is dosha gati, where there is movement of the doshas, because it has now gained enough strength that it's not being contained in its own place anymore. It has the ability to move to another state or another domain of another dosha. Okay? So the next state is sthana samshriya. Sthana samshriya means where it is going and occupying, or it's moving over to the sthana or the domain of another dosha. In the example where the kapha is increased exponentially in its domain and at the state of sthana samshriya, it has increased so much so that it's producing now the blockage in your sinuses. You get that constricting, scratching feeling in your throat. You're not able to really function. You feel that heaviness in your head. But it is so much so, the qualities and the quantity of kapha has increased so much so that it now needs to pass on to another domain. It needs to spread because it cannot stay only in its own place. It needs now, it needs the ability to spread and to infect something else. So in the state of sthana samshriya, this is where you get the dosha dushya samurchana, where there is a combination of the dosha as well as it starts to affect the dhatus. It starts to affect the other doshas as well. It's moving, it's spreading. So this is where we talk about dosha gati, which means the doshas are moving. Gati means movement. So their doshas has the ability to move. Okay? So in sthana samshriya, the kapha has increased. Now it starts to spread. Where does it spread to? It'll start to spread to the lungs. It's the natural next place where it can move on to. And in the lungs, even though it's still in the chest area, but the lungs is really actually a domain for vata. It's one of the places where vata is located. So now the kapha is starting to move to the domain of vata here in the lungs. It's starting to trickle down and starts to infect that area as well. And when it starts to move, that's when you get these premonitory symptoms or the precursor symptoms to an actual disease condition. So now it's not just a cold, or it's not just a symptom of being a cold, but it's now progressing so much so that it could be the precursor to something like asthma, where it's kapha that is increased so much that it is now starting to settle into the lungs, starting to infect or affect the normal functioning of vata in the lungs. It starts to obstruct the movement of vata, and there now it becomes a condition of kapha and vata, and not just the symptoms of just an increased kapha alone in its own place. It's now both things in two domains. Okay? So that's where you get now the premonitory signs and symptoms, or these symptoms that is giving you an idea that if you don't correct it at this point, it will now form into an actual pathology of leading into asthma, or a condition of asthma. So here again, depending on the stage or state of where the doshas are at, will determine what sort of corrective measures we need to take. If we were to correct the kapha or take away the factors that are increasing kapha at the state of sanchaya, it can no longer go ahead and it doesn't get a chance to gain the strength to get to the prakopa stage. If it gets to the prakopa stage and we are still consuming, we are still exposing our body to the same qualities and the same gunas and the same activities that are giving strength to this dosha, again, it gains strength, so it moves forward. If we stop it there, if we take away all of the factors that are feeding into the dosha, it doesn't get a chance to move forward, it doesn't get a chance to increase in quantity, and it doesn't get a chance to affect the other doshas. It won't be able to move to the domain of the other doshas. So that's how we know the intensity or the strength of the measures, the intervention measures that we need to take. So for instance, in the state of sanchaya, just by taking away or not eating a banana or drinking some hot water, that is sufficient enough to get rid of those signs and symptoms of an increased kapha. At the state of prakopa, we may need to do a little bit more. So even if you were to do some pranayama that actually increases circulation, if you were to jog or if you were to do some exercise that increases the heat in your body, that also helps to pacify the kapha. If you were to consume foods that are very light to digest, that are very hot in nature or hot in potency, things that are spicy, that again is opposite to the qualities of kapha and help to reduce that quantity and the hyperfunctioning of the kapha. So for instance, if you have a cold and you drink hot soup, that's why you feel good after you drink the hot soup. It is opposite to the qualities of the things that were feeding into the kapha and that was giving it strength. Because again, kapha is cold, the soup is hot. Kapha is heavy, the soup is light to digest. It increases the agni. So all of those factors are against the kapha, so it helps to again take away from its strength and pacify it in its own place. If the kapha has increased again so much so that it's in prakopa avastha, it is completely filling its domain, at that point we need even more measures to correct it. So for instance, you won't just need to do some amount of exercise, you won't just need to have soup, but you may need to do something like use a neti pot, or where that's flushing out the kapha that is accumulating. You may need to take some herbs like dried ginger, for instance, that also helps to remove the accumulated kapha. It has all of the qualities opposite to kapha, but also helps in removing any kapha that is stagnant or that's sticking to the channels. Another example of that, using ginger and dried ginger and honey. Honey also has that ability of removing or scraping out the kapha that has accumulated in the channels. So at the state of prakopa or prasara, we would need to do, again, add to the measures that would help to pacify the dosha. When it gets to sthana samshriya, it's a little bit more complicated, because now we have kapha dosha that's very strong, and that we now are starting to get a slight increase of vata dosha as well. And here you can even consider the vata dosha as getting to the state of samshaya. But the reason here, it is not vata that has increased on its own. It is vata getting disturbed because of the strength of kapha, and because kapha has now gone into its domain and it's disturbing vata as well. So here is where it starts to get a little bit more technical in the sort of intervention methods that we use, because now it's tricky. We have to make sure that whatever we do will help to decrease the kapha qualities, push it back to its own domain, as well as not increase vata in its domain. So here again, we would need to look at the qualities that help to pacify kapha as well as vata. But more so kapha, because kapha is the one that has the most strength here, and vata is now starting to gain strength or gain a disturbance because of kapha being in its place. Okay? So in the state of sthana samshriya, that's when we again have the premonitory signs and symptoms of, say for instance, a condition like asthma. And asthma, as per Ayurveda, is a condition that can be fixed if it is of a recent onset. The more chronic it becomes, it changes from a curable or a treatable condition to a manageable condition. And these are, again, things that we'll be talking about in the live sessions, where we're going to look at prognosis of a condition as per Ayurveda, and what are the treatment measures we need to use according to where the doshas are at. And how do we determine that? It goes again back to the same description of the increase of doshas and which ones are primary, which ones are secondary, and how to approach these in reducing the disease condition or reducing the pathology. Okay? So the next state is vyakti. Vyakti means something that we're able to see. It's vyakta. It is visible. So at this point, the two doshas have become so strong enough that it's producing a full-on pathology. So at this point, we don't just have some symptoms, we don't just have some discomfort, we have a full-on pathology that we can name. We can definitely say that, oh yes, this is absolutely asthma, or this is absolutely another condition. We can name it now at this point. Now, you may come up with the question, well, there are a lot of conditions that Ayurveda does not necessarily have names for. And that's true. But even if we don't have a designated name in Sanskrit or in the Ayurvedic text for that pathology, we can still bring it down to this stage of Vyakti, where we can decipher which are the primary doshas involved, which is the secondary dosha involved, where is the sthana or the domain where it is producing this pathology, it is exhibiting these signs and symptoms, and how far it has progressed along that we need to choose the appropriate corrective measures to help to balance out these doshas again. Okay? So at the state of Vyakti, it is known as the Rupa Avastha, or the state where it is fully showing itself as a disease condition. Okay, so here is where we get into the treatment or chikitsa aspect of Ayurveda, and that's what we're going to be talking about in each one of the modules. The next state is Bheda. So Bheda is actually not just looking at pathology, we're not just looking at the disease condition, but we're looking at chronicity now. Now it has become a full-blown disease. It has a name, it has a form, we know which doshas are involved and how the pathology of how this has progressed. But now if again we continue to feed into the qualities or the gunas and giving more and more strength to these doshas, it has become chronic now that it starts to produce complications of that disease. So for instance, again, if we were to get the asthma or the condition where kapha first started, then it has affected the vata in the chest, in the lungs, and now it has produced the state of being an issue with asthma, with breathing, and it has become so much chronic that it's not just asthma, but it has started to produce other symptoms and other conditions secondary to this untreated asthma condition. That is known as the state of Bheda. Bheda means classification or types or other things other than the main dosha. So here you get now types. So for instance, if you have, we talk about Shwasa or we talk about asthma in Ayurveda, it's not just asthma in its first stage. Now it can be divided into different types of asthma. So in different types of asthma, we also have the kaphaja type of asthma, the vataja type of asthma, the pittaja type of asthma, or the asthma that is absolutely incurable, where you can even just manage the symptoms, signs and symptoms, and not reduce the ability for the body to produce asthmatic attacks, but you can never completely rid the body of this pathology. The person is always going to have to live with the fact that they do have asthma and they are more susceptible to having attacks if they feed into the qualities and give the asthma or the disease strength. So here, where in this process we're looking at, we've talked about the disease gaining strength. This is really important again when we look at chikitsa in Ayurveda, because we need to know how much strength this disease has, because this is known as the roga bala, or the strength of the disease. We also will equally look at the rogi bala, or the strength of the patient. And this is somewhat similar to what we look at in Western medicine, where we're looking at a person's immunity and their ability to fight against disease. Because here it's somewhat of a similar process. We're looking at which qualities are feeding into the disease and giving this disease strength, as opposed to which are the qualities that would feed into a person's innate immunity or their strength and have the ability to fight against or to combat this disease. Now here we're not looking at disease that is coming externally. It's not developing due to external factors, but the disease is actually developing due to the innate ability of these doshas and it gaining the strength and the ability and the qualities that's producing a pathology. So here we're looking at the roga bala versus the rogi bala. And the rogi bala is what we're going to talk about in the next video, where we look at how to examine a patient. And when we're examining a patient, we're looking at where their innate strength is. Do they have the ability to naturally fight against this disease condition, or has their body become so weak that we need to get rid of this disease condition as well as support their strength so that they are not going to be susceptible to getting that disease again? Okay? So these are the 6 stages, are known as the SadKriya Kala, where we're looking at the pathogenesis of a disease. So as you can see in this picture, to reiterate what we just talked about, you see a dumpster that is overflowing and that has a lot of waste product and garbage that's around it. So in the state of chaya would be, if you're adding garbage into this dumpster, it's slightly there, but it's still within its container. It is sort of stinky and it has these abnormal qualities, and you don't necessarily want it there. You want it to be a clean container, or be able to have its normal function. But again, it's not disturbing anyone else. It's in its place, and it's increasing in a orderly fashion. Whereas in the state of prakopa, if we were to add more garbage into that dumpster, the more we put in, again, it's contained in its own place. It's still not disturbing any of the external factors. It's not disturbing anyone else, but it is there in the dumpster. It is there in its domain, and it's building, and it's getting more and more and more in quantity. Now at the state of prasara is where you can see the dumpster is filled all the way to the top, and it's getting ready to flow over, but it's still, again, contained in its own domain, but it's unsightly. It's definitely not something that we want to deal with because, again, it's producing more amount of stench, it's more in quantity, and it probably shouldn't be there. At the state of sthana samshriya, this is the point where the dumpster is overflowing. It starts to now, it has completely engulfed and taken up all the space in its domain, but it's still gaining more and more quantity. So it starts to spill over from the dumpster, from its domain, and it starts to now affect the area around that. So this is one thing for us to keep in mind, that when the dosha starts to spread, depending on where it has collected in the first place, it will spread to the nearest outlet that it has and start to infect that first before it starts to infect something else. So for instance, if the dosha started to increase in quantity, say first in the colon, then the first place that it's probably going to affect is one of the domains of pitta, because pitta is the next dosha closest to the colon, closest to the domain of vata. So that's why it may not necessarily be in the stomach, but pitta also has other domains as well. So for instance, in the blood, or it may affect the skin. But what it's going to do is the major domain of pitta is the one next to the major domain of vata. So if the original pathology, the original increase of dosha started in the colon, which is the domain of vata, then the next progression is the one closest to it. So it is most likely going to affect the pitta, or any one of the places where pitta is located. And depending on where that weakest structure is, or the weakest functioning of pitta is, it will affect that one first. Okay? So at the state of sthana samshriya, it has now overflown. It is now starting to affect and to pollute the surrounding areas. So it's now gone over to the next state where it does not belong, and it's starting to infect or pollute that adjacent area as well. At the state of vyakti, this is now where it is a full-grown problem. Now we know that this is complete pollution. It's not contained in the dumpster anymore. It's not even an overflowing dumpster, but it is really pollution. It's full-blown pollution. It's unsightly. It's something that you absolutely do not want, and you want to make sure that you correct that. You want to have that picked up. You want to have that cleaned up. So that is the state of vyakti, where it's very much visible. It's something that you can't avoid looking at, or you can't avoid seeing. So for instance, in one of the earlier stages, you may have signs and symptoms. And it may be a discomfort, and depending on how your body immunity is, you may want to ignore those signs and symptoms. Oh, well, I can deal with that. Oh, I have these headaches. It's okay. I can take some painkillers and I'm fine. And you go on ignoring these signs and symptoms that your body is telling you something is happening, something is wrong. But at the point of vyakti, it becomes a full-blown pathology. It is a disease condition now. You know it's there. You can't avoid it. It's no longer a symptom that you can just push aside or suppress with whatever medication you're taking. It becomes now a disease that you have to address because it's in your face, it's grown exponentially, and it's something that needs to be addressed. So that's the state of vyakti, where it has taken over now. And Bheda, again, if you don't start treating or you don't start taking measures to correct the state of vyakti, then it becomes Bheda, where it's pollution of the dumpster, it's pollution of all the sites surrounding it, and it's pollution that starts to spread. So at this point, it's not just that unsightly garbage that has accumulated in the dumpster, around the dumpster, but the smell starts to increase so much so that even if you're not near the dumpster, you can still smell the garbage. You know, it's so much so that even the disease starts to infect and create now extra secondary problems. So this is just a quick description or an example of these 6 stages and how you can understand that. And we're going to look at this particularly in each one of the modules according to which system and which disease condition we're looking at. So for instance, in the first module, we're going to be looking at how a disease progresses in these stages and it becomes known as an issue like IBS or an issue like chronic fatigue syndrome, or depending on which module we're going through, we're going to look at how a disease is progressing in these 6 stages and becomes what we know, what pathology we know. So now that we've reviewed the 6 stages of pathology and disease progression, we'll be able to understand how we need to approach this disease and treatment of it. So this is going to be now the basis of what we're going to be learning in each and every one of the modules. Hope you enjoyed.